What's up, future nurses? It's Medication Monday. We are back like we never left. Today we're going to talk about an herb or a supplement that you're going to want to know for the NCLEX exam. We're going to talk about St. John's wort. So what is this? This is actually an herb that is given as a supplement, and it's given as an antidepressant to help decrease the signs and symptoms of mild to moderate depression. Don't confuse this as something that can actually be given for patients with major depressive disorder. This is for moderate and mild cases of depression, okay? This can also treat other mood disorders such as mild OCD. And one of the key takeaways that we are going to talk about later is the possible interactions that this medication can have, or the supplement rather, with other medications, okay? Brain hack, I don't really have anything clever to help you to remember this. Just know that this particular supplement or herb can interact with other medications, okay? So some side effects and precautions that we want to talk about is phototoxicity. This medication can cause phototoxicity, so that's something to be cognizant of and aware of when this patient is taking this herb or supplement. We also want to notify and educate this patient that they need to discontinue this medication 2 weeks prior to any surgeries. Okay, that's a huge contraindication. We also want to know and be aware of any general anesthesia procedures that they might be having coming up, because this can actually cause cardiovascular collapse. Okay, that's very serious. We want to make sure that we are making sure that the patient is aware of these things. Okay. Drug interactions. This is huge. Star this, note this. This is what you want to know. This can cause serotonin syndrome when interacting with tricyclic antidepressants, SSRIs, SNRIs, and MAOIs. Okay, so this is why it's very important for us to be communicating with our patients and getting a background of any medications that they're taking, any other supplements, things of that nature. And we'll talk about that here in a minute. But the main thing and takeaway that we want, that the NCLEX will want you to understand, is that this can cause serotonin syndrome if taken with tricyclic antidepressants, SSRIs, and SNRIs, and MAOIs. Okay, so what does that look like? Patient might display nausea, vomiting, diarrhea, shivering. In severe cases, you'll see muscle rigidity, fever, and even seizures. This is fatal if not treated, okay? So that we're going to intervene very quickly if we have a patient that's experiencing any of these signs and symptoms and they're taking that medication, okay? So nursing considerations, nursing interventions, obviously we want to follow up and monitor and assess for signs and symptoms of depressions over the course of treatment with this herb. We want them to follow up with their HCP or healthcare provider while taking this medication, right? We just don't want somebody taking this blindly that is trying to treat depression. We want them to consult with their HCP. We need to know about any other medications, over-the-counter medications, supplements, things of that nature. And we want them to wear sunscreen in the event of phototoxicity. Hope you found this helpful. If you did, make sure you're following this page, tag a future nurse, and save it for later.